Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. I'm really pleased today. My guest is Hal Wolf, who is the president and CEO of the Healthcare Information and Management System Society, better known as HIMSS. Hal has been involved in numerous organizations and projects since the beginning of the digital health era. And Hal, thanks for joining us today.
Jim, it's a pleasure to be back, and thank you for having me.
Hal, we're just a few weeks short of HIMSS 21, the preeminent global health conference. We all know what happened last year when the annual conference was canceled due to the COVID-19 pandemic. What a difference a year can make. We didn't know where we were, and hopefully in the whole pandemic when you had to cancel. But now we're looking forward. So let's talk a little bit about the upcoming HIMSS conference. It's going to be in Vegas in, I believe, August 9th through 13th. And I'm looking forward to seeing you there. And I'm just glad to be back at HIMSS this year.
Well, Jim, we're very excited, first of all, that you're coming. And, of course, we're very excited to be able to host this year's global conference in Vegas. And we'll be welcoming the CIOs, the senior executives, the providers, the payers, the IT consultants, the entrepreneurs for education, networking, the whole collaboration. It feels a bit like a homecoming and a bit of a rejoicement to be able to get back together again this August. So we're very excited, and we're just a month out at this time. So it's wonderful to finally get back on track and start to explore a new normal.
You know, Al, I like what you said about homecoming. I've already made my list of educational sessions I'm going to be attending, and gone through the list of exhibitors and who I want to visit with. You know, truthfully, one of the things I like the most is it's the one time every year I get to meet and talk to people that I do business with virtually throughout the year. So it does feel like a homecoming.
You hit on something very important, and that is that there's an incredible amount of pent up energy for people to be able to see their friends, right? There's a social networking component of coming together. When you complement it with digital, which is fantastic, I think we're all just really looking forward to seeing each other.
Well, and the theme this year for HIMSS 21 is Be the Change. And that's about as topical as you can be, because the change that we've been through over the last year and a half, if it could not have been predicted. And so we'll get into the details in that in just a minute. But I heard a rumor the other day, you'll have to confirm it for me, Hal, that HIMSS is actually turning 60 this year. Is that possible? Is that true? Has it been 60 years?
It is true. Yes, this is the 60th anniversary for HIMSS, and it's a tremendous milestone. We couldn't be more excited. You know, HIMSS is a society, and a society of individuals that have similar interests, professions, concerns. We come together every day across the globe, and it has been growing tremendously. If you go back to 1961, HIMSS fundamentally welcomed their first 47 members that joined for those shared purposes and to promote a continual improvement of hospital management systems through organizational programs and research, education, professional practice. And this year, we are now over 110,000 members globally. Just 4 years ago, and I can't believe this, Jim, I'm coming up on my 4th anniversary in mid-September, and we were under 70,000 back then. And now we're over 110. So our growth has been exponential, especially in the last year and a half, because as the world has shifted, as you pointed out, to this new world of digital health, well, guess what? There was an organization globally that had been working very hard on it for 59 years, and now coming up on its 60th anniversary, we just couldn't be more excited that what we have been working towards has actually helped and contributed what has been a very difficult time for healthcare systems around the globe. And we would always be remiss if we didn't point out the incredible efforts of our frontline workers and all the tools that have been put at their disposal, as well as all of the patients and the citizens who have benefited from digital. So we are very excited about it. This year and beyond, we're celebrating our role, as a trusted source for key insights and policy and advocacy, education, workforce development, all the things that is HIMSS. And we are looking forward to that celebration in Vegas in the next month.
Well, one thing, Hal, that kind of strikes me is in healthcare and in healthcare information technology, we're always looking for best practices. And so this giant conference that we're having in a few weeks, and I'm looking forward to joining you there, HIMSS is having to put together a best practice to put on a large in-person week-long event, basically, while the COVID-19 pandemic, though it's weakened, it's still out there. And so HIMSS has had to approach this, this whole thing about what to do to make it safe for people to come. So let's talk to the details of that a little bit, if you don't mind.
Not at all. Well, listen, when we made the tough decision in 20, we made the decision based upon the health and the safety of anyone who we thought was prepared to attend. We didn't know, as you pointed out earlier, how big it would be, beginning, middle, end, but we took the right precautions. And again, I just can't even imagine what would happen if we hadn't. So coming into HIMSS 21, we said, look, it is incredibly important for us to create as safe an environment as possible, to follow the science, and to ensure that as people come, they can be assured that the people around them are as safe as we can make it. So we began the process of talking with outside advisors and organizations and came to what we believe is appropriate policy, which is that if you're coming on to the HIMSS campus, you must show proof of vaccination, and vaccination by vaccines that have been approved either by the CDC in the United States or approved by the World Health Organization up until July 26th, which is, of course, a couple weeks before conference. So as long as people have been vaccinated along those lines, they'll be welcome onto the campus. It was a difficult choice. We do understand that some people have particular feelings about the vaccine and may not choose to attend because they're not vaccinated, and we absolutely respect that. But to be able to have an exhibition as close to normal as possible, to be able to see our friends and families, as you just pointed out earlier, we felt that this was the most appropriate approach. And then we had to figure out, how do we fulfill it? Because HIMSS is not in the business of collecting data and information from people from a HIPAA standpoint. And so what we've done is we've turned to two outside firms that literally create three different ways for people to prove that they have been vaccinated and get the validation, if you would. One is with the Clear Health Pass validation, which is very simple to do. It took me less than 5 minutes and very simple. My family has done it as well. And that is perfect for U.S. citizens that have CDC cards. If you're from outside the U.S. or you received your vaccination a different way, the Safe Expo Vaccine Concierge Validation Program is available, where again, ahead of time, you can go into their app and you can use it and get validated based upon your proof of vaccination. And then for those who don't do it ahead of time, and we encourage you to do so, by the way, because it's less than 5 minutes, if you come on site and you need validation on site, Safe Expo will also be able to take care of you on an on-site basis. We're using third parties so that HIMSS doesn't retain or see any specific data. All anyone will know is that you have been vaccinated, that has been validated, and once you pass through that validation, you will get your HIMSS tag, which will allow you entrance, as always, to the HIMSS campus, and then that'll be the end of it. So if you do it ahead of time, it's about a 5-minute process.
And I can attest to that being a 5-minute process. I downloaded the Clear app last night onto my phone, took a picture, put in some information, and now just waiting for final validation of it. So it didn't take too long at all. It's, I think, a best practice that this has been outsourced to a third party. Now, if any other conferences say, well, we're not sure how this can be done or it looks too difficult to do, they can kind of point to the work that the HIMSS staff has done in terms of due diligence to see that it is possible to do this. I know that at the HIMSS website, there's also a health and safety hub page with a lot of information. I know additional precautions are being taken in terms of masks are available if people want them, and antibacterial, antiviral dispensers are available. So I know there's quite a bit being taken there. So I'm looking. I know it's a big project. Hopefully, this will be the only year we have to do it. But after this year, if we have these things in the future, there's a process in place. So that's good. One thing you mentioned, Hal, was that as in the past, for folks who couldn't attend for whatever reason, this year may be additional reasons, but this year there's a HIMSS 21 digital. And so is this virtual participation different from any of the virtual offerings at prior conferences? Anything different than those other offerings? How's the digital going to work this year?
Yeah, thank you for asking. So yes, it's quite different. So in the past, of course, we've always had, as we will this year, an amazing conference. We'll have the peer review. We'll have incredible panels and keynotes, and all of those can be found, of course, at HIMSS.org, and you can go on the site and see all the terrific programming. We can touch on some of that in a bit. The other thing we're doing, when we go back, our lesson learned this year, Jim, was that we began with HIMSS Digital 20, which was the digital representation, if you would, or programming that was all set up for HIMSS 20. We couldn't do it, obviously, in person, so we went back and we started doing tapings, podcasts, interviews, panels, etc., and we put them up on HIMSS 20. From there, we began using digital formats. We used them in Europe, overseas, in the United States, and we grew to really understand how people appreciated and liked and we could receive information, and we kept improving on laying out digital programming. So this year, in conjunction with the physical HIMSS 21, we're bookending it on both sides, one with the digital programming before and then after. And up before, we're really putting on the theme of the year that shook the world. Over the past several months, we've had so many emotional storylines. We've learned a lot. We're understanding what happened and where our gaps were. That's really about understanding what has occurred. And then understanding what does a more equitable healthcare system look like and how do we integrate more digital health into it. Then we have the conference itself. There's a lot of equity components built into it. Of course, the storyline about where we are and where we're going and being the change and recognizing this massive change management component that we're under. And then digital health, HIMSS 21, will follow with a vision for the future on the backside of the conference. If you would, keep the conversation going. So there's some great digital keynotes that are coming in on HIMSS 21 on the digital side. We're looking at everything literally from, beyond the changing lives of the pandemic, led by the CEO and president of Cleveland Clinic. I don't know if you know Tom Mihalovich, but he's going to be leading that conversation. We have Ariana Huffington coming in and talking about basically how you look at burnout and what you do to get past it. Very, very important today inside all of our healthcare systems. We have nursing innovators, driving force for healthcare reform. Nurses represent over 50% of the healthcare workforce. So there's a concentration and fireside chat with leaders. And this is all happening in the digital environment. So we're very, very excited about the digital programming that's going to be bookending the HIMSS conference itself. And I think moving forward, and by the way, during the conference itself, some of the keynotes and stuff will be live streamed into the digital package as well, and of course on other platforms. So we're very excited, like Facebook as an example. So we're very excited about how we're going to be bookending it. We do recognize not everyone can get to HIMSS 21 this year because we still have some travel restrictions, either by companies or countries, etc. So we put this incredible digital package together to help fill out both the gaps and, if you're attending, to add to the conference so it's more than 5 days. It's literally happens over multiple weeks.
One of the things you mentioned there, Hal, is some of the keynote addresses. And I know at the conference, the opening keynote is entitled Preserving the Health of a Population, Early Lessons from the Pandemic. And it's not too soon to start looking at the early lessons. And so I'm particularly fascinated by that. And then I think maybe the next day there's a keynote on the healthcare cybersecurity, resilience in the face of adversity. Those kind of things are about as topical as you can possibly get. You know, especially around healthcare cybersecurity, you really can't wait until some expert writes a book on that or some courses are offered in that, because that is an emergent situation. That's a pandemic in itself, healthcare cybersecurity, as we're well aware. And so just to be able to listen to subject matter experts who are dealing with this on a daily basis, it's pretty critical. That's an area I'm really fascinated in. So those keynotes I'm looking forward to.
I think one of the great blessings, Jim, of HIMSS this year, in particular 21, is that we have come through a lot in this pandemic, but it's not over. We have a shifting landscape that is accelerating around us. And to hear experts in real time who have lived through it and can bring light and subject matter expertise in things like cybersecurity and population health. And while the lessons are fresh in our heads about what we need to do differently tomorrow, that is one of the beauties of attending HIMSS. Additionally, and you mentioned it earlier, seeing our friends who we've not had a chance to see and to have a conversation in the hallway, to be able to come onto a safe campus and to be able to hear what is happening from many of the market suppliers that have been working feverishly hard over the last year to adjust their offerings to handle digital health at a whole new level.
Absolutely.
Because of the demand. I think this is going to be probably one of the most soul-searching, interesting, and learning opportunities amongst any HIMSS that has ever occurred.
I'm always fascinated when it comes to HIMSS, but because I can find those avenues or channels that I'm particularly interested in, and could search out exhibitors or educational sessions. So I'm always interested in things like precision medicine, social determinants of health, those kind of things. But this year there's a opportunity to kind of look back and see what's happened over the last year and a half. And put things in perspective. And that really often has to do with technology. And I'm speaking specifically here about telehealth, where the vast number of providers in the U.S. have never done anything with telehealth. And literally in 1 week, they had to adopt a platform and make it work. And not even talking about the government being able to come up with some coding reimbursement for that. That telehealth technology was there, but it really wasn't being utilized. Then all of a sudden, it was forced into use. And so those technologies, hopefully that so much was gained there that can now be used for remote patient monitoring and things like that. So just to get a perspective on what happened, over the last year and a half and still continues to happen in terms of that healthcare technology. And it's going to be fascinating.
I agree. And I think that what we saw, and of course I hear this globally, the adoption rate, of course, in the United States, great example, was literally 32 times what it was. In some cases, over 3,000, depending upon the system. And we broke through a really interesting barrier Jim, I've heard someone describe it the other day, and I agree with it, is we gained in 10 months what normally would have taken 10 years in healthcare to make a transformation. And organizations grabbed any technology that was literally available. Part of it was the spaghetti theory, right? We'll throw it against the wall, and if it sticks, we're good to go.
Sure.
But and many of them did, and they did very well. But a lot of systems now are coming out, and we hear this from the attendees who are coming, which is we're rebuilding our strategies. We recognize it's technology and it's the people and the process side. And so professional development is getting a lot of focus point. How do I retrain my organization to now maximize the use of the telehealth that I wasn't using 10 months ago and now is a staple? The customer perception that we knew would come through the use of telehealth, well, guess what? They've recognized. And so they're looking up and saying, I need to have my checkup at home. Why do I go in for 3 hours? If it worked here yesterday, why won't it work here tomorrow? So there's a workforce training and there's a recalibration which is taking place. And people are going to be walking the exhibit floor and hearing the panels and listening to the sessions, which are amazing, of the experience of people of what worked, what didn't work, and where they're headed.
The HIMSS conference is always timely, but this may be the most timely of all of them. Just to review the last year and a half, what's worked, what hasn't worked, where lessons can be learned. You mentioned telehealth there. Yeah, the providers had to learn how to use it. Patients had to learn how to use it. And so it was that, it was, the mother invention. Necessity was the mother invention. Who knew that would happen? But it did happen. So, it's going to be fascinating to hear some of those sessions. I'm sure there will be some roundtables just on those technologies that really had been sitting on the shelf, but had to be brought out. I think it was the third week of March where all of a sudden, there was a universal belief that everything's going to shut down and needs to shut down now. And everybody had to scramble to figure out what to do. I mean, literally within a couple of days, certainly in less than a week. Healthcare, schools, everything. So we're not totally out of the woods yet, but the system held. Healthcare was still delivered. It's terrible what we went through. It's been over 100 years since this country's been through, or a global pandemic, but I think we're at least far enough now that there can be some reflection, and I think that's going to be quite a bit what we'll be seeing at HIMSS 21 here in just a few weeks. So
I agree, and I think that the reflection to me is really somewhat analogous to the three components of the program this year. It really is a reflection on what happened, and we've got to be continuously clear with ourselves about where our gaps were. We got caught shorthanded on population health. We didn't have systems that could readily respond to this pandemic. We didn't know our numbers. We had a hard time collecting them, and it was global.
Yep.
So the U.S. is not alone, let's be very clear. In fact, we were better off than many, but still not even close to what we need to be able to do from a back-end system standpoint. And then at the individual system level, as you said, mothers and necessity, we had to absolutely change the way we were delivering care. And we don't yet know the long-term impact of what is sometimes called long COVID, which is the impact on disease management state of people who caught it,
right,
and what damage was done, and how will that contribute to what is already very difficult and hard-pressed utilizations inside systems, right? We have shortages of workers, and yet we've got a whole new layer of chronic disease management that we're just beginning to understand that's going to be left over in age groups that are much different than the normal profile of chronic disease management. So it is very timely to hear where the experts are thinking globally, what we need to change, and then on that last part, on the last digital piece, how do we handle it on the future as well? And I think you're going to see, because I've gotten some previews, some amazing things in the interoperability showcase, innovation that are taking place in healthcare. It is really going to be one heck of a lesson learned this year.
I'm looking forward to being there. Hal, our time has rushed by here, so let me speak to our audience and thank them for joining us on this episode of Tate Chronicles. I offer a special salute to my guest today, Hal Wolf, President and CEO of HIMSS. Hal, thanks for coming aboard today.
Jim, as always, it's an honor and a pleasure, and thank you for having me.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.